It started as a family business. Nina and I started business together. I basically focused on the science, the manufacturing part, product design, innovations, listening to physicians, listening to consumers. And Nina would focus on the market penetration, talking to the drugstores, talking to the club stores like Costco, and talking to food chains like Safeway and Super Value and Kroger. There was no way we knew how to go to the store. Stores will not accept the product easily. Stores would like the product liability insurance, and we did not know what is that. So we had to start getting the product liability insurance. And then it was not easy, because if you put the product in the store today, even if any company puts, from big pharma company to big electronics company, how would a consumer know to go to the store and buy? An average person or inventor cannot afford TV ads or radio ads or newspaper ads. Like just a one spot on the prime channel during prime time is going to be $100,000 for nationwide transmission. So that's out of question. So we thought that physician model will be a good model. So basically, we'll try and contact physicians. First, we showed the product to the physicians at national conventions. They really liked the device. We decided that just like pharmaceutical industry gives out samples, that we will do physician marketing and give samples to doctors to try out. So when we took that approach, doctors started using the product in their practice. They got excellent feedback from their patients that I wish I had this device a decade ago, 20 years back, 40 years back. So doctors got very excited, and they started giving feedback to us that this is something best that you've done. And once we started getting those comments, we got more encouraged. So basically our system was by phone, by fax, by mail, and through the doctor's offices. And then we created like a few groups of doctors, which we identified. So some doctors will be stocking. It means they will buy the product and they will pass it to the patients. They'll give it for free, or they may charge nominal amount or cost to cost, or some may mark it up. Then we created a group of referring doctors. So these doctors will not be buying any time. These doctors will be referring. What I mean is, like, they will tell their patients that you need NeilMed sinus rinse. So obviously patient would ask where to buy. They say, here is a company, call them. So when consumer calls, we will ask them that which pharmacy do they go to. So they say, we go to whatever, Mr. Johnson's pharmacy on A Street. They'll find that pharmacy on Google. It had just started happening in early 2000. There was not much in terms of internet search on a big scale. So we'll contact the store and say, patient wants it. Can we ship it to you? So he will be reluctant. So we say, okay, how about we ship it to you for free? If he buys, then you pay us. If he doesn't buy, don't pay. So he'll say, okay, I will take it. So next time patient tells the doctor that I got it at Mr. Johnson's store. So now doctor, next patient, he will tell, go to Mr. Johnson's store. And then Mr. Johnson will buy second and third. But he gets tired after a while. He already bought 6 in 2 weeks or 1 month. So now I will buy a box of 48. So that becomes now a complete cycle from NeilMed to Mr. Johnson's pharmacy. And until about year 2005 or 4, so almost about 4 to 5 years after launch of the product, products were not on the shelves of the national chains. They were only in doctor's offices, online, and mail orders, and the phone orders, and the fax orders.